person stands on one leg and raises the other leg and his pelvis tilts downward on the opposite side, definitely this person exhibits a positive Trendelenburg sign. Hi, this is Adel Hajjai from the Anatomist. In this channel, we are helping medical students to understand and enjoy human anatomy. If you are new here, consider subscribing. In 1895, a German surgeon, Friedrich Trendelenburg, described his sign to determine the integrity of hip function. In the case mentioned in the beginning, the stability of the hip joint depends on three factors. Number one, the gluteus medius and gluteus minimus are functioning normally. Number two, the head of the femur is located normally within the acetabulum. Number three, the neck of the femur is intact, having a normal angle with the femur shaft. Let's dig deep and do some more anatomy regarding these three factors for better understanding. First factor, gluteus medius and minimus muscle. Gluteus medius is a thick, broad muscle that arises from the outer surface of the ilium between the posterior gluteal line and the anterior gluteal line. Then the fibers converge to a flat tendon that is inserted into the lateral surface of the greater trochanter of the femur. The gluteus minimus is a fan-shaped muscle that lies deep to the gluteus medius. It arises from the outer surface of the ilium as well, but between the anterior and inferior gluteal line. Then its tendon is attached to anterior lateral ridge on the greater trochanter. Both muscles innervated by superior gluteal nerve L4-5S1 and supplied by the deep branch of the superior gluteal artery with the contribution from the trochanteric anastomosis. Their main actions can be summarized in two ways. Acting from the pelvis, abduct and medially rotate the thigh. Acting from the femur, they play an essential role in maintaining the trunk upright when the foot of the opposite side is raised from the ground in running and walking. Bottom line, the ipsilateral gluteus medius and minimus contract to stabilize the center of gravity and maintaining a relatively horizontal pelvic position. Paralysis or even paresis cause pelvic tilt downwards the unsupported contralateral side. Second factor, head of femur articulation with the acetabulum. The head articulates with the acetabulum, forming the hip joint, supported and stabilized by one of the strongest group of ligaments in the body, like iliofemoral ligament, pubofemoral ligament, and ischiofemoral ligament. So the acquired dislocation of the hip joint is uncommon. Nevertheless, dislocation may occur during a car accident when the hip is flexed, abducted, and medially rotated, while the congenital dislocation of the hip is common with a prevalence of 1.5 per 1,000 live births. It affects girls more than boys, and approximately 50% of the cases are hip dislocated bilaterally. In addition, the inability to abduct the thigh is characteristic to congenital dislocation. The affected leg appears shorter because the dislocated femoral head is superior to the normal side, resulting in a positive Trendelenburg sign. Third factor, neck of femur intact having a normal angle. Normally, the neck of the femur is inclined at an angle with the femoral shaft. In adults, the angle is approximately 125 degrees and about 160 degrees in children. Increasing in this angle is known as coxa valga. That is clearly what be found in cases of congenital dislocation of the hip joint, which result again in positive Trendelenburg sign. Thank you very much for watching this video. If you like it, hit the subscribe and like button. This will support the channel. Share this video with your colleagues and let me know in the comment below if you want to discuss a particular topic. See you in the coming video.